Hey, so thank you, Mr. Chair. This month happens to be Oral Health Month. And so we thought it would be an opportune time to hear an update from our oral health program. I know oral health has been something has been very top of mind for a lot of people within our service area. I know many board members have also asked about those services, so I think this will be quite timely. And I'd like to invite up Stephanie Meyer, who's the manager of the program, and Jody Mackey, who's the health promoter with that program, to provide this update. So over to Stephanie and Jody.
Welcome. Thank you very much for the introduction. So as Dr. Kirji mentioned, in recognition of Oral Health Month, we'd like to provide an update on our oral health program that Public Health Surveying District offers. So as you mentioned, my name is Stephanie Meyer, I'm program manager, and co-presenting today is Jody Mackey, our health promoter. So the oral health program falls under the Health Promotion and Vaccine Preventable Disease Division led by Stacey Gilbo. So in a brief moment, we will begin by discussing our school screening program, Healthy Smile of Ontario. She'll do a brief discussion on community fluoridation, and then I will discuss the Ontario Senior Dental Care Program. So all four of these programs are mandated through the Ontario Public Health Standards, each having specific requirements and protocols they must follow.
So tooth decay is actually the most common chronic disease of childhood in Canada and around the world. Untreated tooth decay in children can be very painful. It can affect concentration and school performance, can disrupt eating and sleeping, can also affect permanent tooth structures like they grow in, and it can lead to life-threatening infections. Dental disease is actually the leading cause of day surgery under general anesthesia for children under 5, which increase risks to the child as well as cost. Some children do have increased risk to tooth decay related to inequities in the social determinants of health. Those would be children from families with lower incomes, children in rural areas, Indigenous children, as well as and newcomer families to Canada. So one of our programs involves annual school screening. We go into all the elementary schools and schools in some First Nation communities. And what we're looking for is children with urgent dental care needs or children who may be at risk of oral health or maybe preventive services. So through the screening program, any children identified with urgent needs, we will follow up with their families to help connect them with dental providers, social financial assistance programs. We're also going to monitor their progress in care to make sure if they're in pain that they get treated quickly. We also collect and report surveillance data, and we're looking at following trends in oral health status over time, and then we can identify potentially schools or populations who may be at higher risk. They need some targeted programming. So this slide shows screening results for the 2023-2024 school year. We screened about 11,000 children, and surveillance data was collected for those in JK, SK, grade 2, and grade 7. We can see that about 80% were caries-free, which is great. We'd like to see that. And that means they have no active decay or fillings with previous decay. But we do see that about 1 in 5, so 21% of children either had active tooth decay that needed treatment or a filling from previous tooth decay. Overall, 7% of those children required urgent dental care. The findings for schools in Greater Sudbury were similar to what we saw in our district schools. We did see higher rates of tooth decay in schools in our First Nations community, which largely relates to access to services. So if we drill down to certain age groups, pardon my pun, we see that children in JK, 12%, so about 1 in 10, have been affected by tooth decay. And as students age around grade 2, we see that 1 out of 3 had tooth decay. So around age 6, permanent teeth start to grow in. There's grooves in the teeth, there's crowding, misalignment, it can make it more difficult to brush, and parents aren't providing as much assistance necessarily. So this particular age group is at higher risk of tooth decay. So from this, our target group would be children under 6 for prevention. So dental care is very important to prevent tooth decay, but not everyone can afford dental care. So the Healthy Smiles Ontario program is provincially funded, and the goal is to reduce inequities by providing free dental care to eligible families based on income. In terms of our services, we have preventive clinics at all of our public health offices, so cleanings and fluoride. We also provide education, navigation to connect families with dental care, enrollment support, and case management for those children with urgent dental care needs. So even with this program, barriers do still exist for some clients. For instance, it may be challenging for some families to find a dentist that will accept the HSO program. In rural areas, you may have challenges with public transportation or accessing dental care due to a shortage of dental providers in Northern Ontario. We've identified some priorities for 2025 and beyond. So we've already started increasing access to our preventive clinics, in particular in our district offices. So we'd like to continue to increase opportunities for those services. We're also looking to get back into more Indigenous engagement. So due to the pandemic, there was a bit of a pause in this work. So we're really getting back to relationship building and some collaborative planning to develop oral health strategies in collaboration with partners in First Nation communities. We also want to look at some upstream approaches to promoting oral health, really to fit with our agency priority to look upstream. And then, as I noted earlier, children under 6, we really want to focus on preventing those early childhood cancers. I wanted to briefly mention our work with community water fluoridation. So this involves adjusting the fluoride levels in drinking water to optimize dental benefits. It's safe, it's effective, it's cost efficient, and an equitable way to prevent tooth decay in a population. So our role for communities that do add fluoride to the drinking water, we will review monthly drinking water quality reports, and that's done in collaboration with the Health Protection Division. And if there is a problem and levels fall outside of the therapeutic range for 90 or more consecutive days, we will respond by advising the public and dental providers that they aren't getting the optimal levels of fluoride.
Hey, Jody. So as Jody just reviewed, oral health is really important for children, but it's equally as important for our older adults. So research shows that there's a link between periodontal disease and several systemic and chronic diseases. So for example, poor oral hygiene can be linked to bacterial pneumonia. There's an increased risk of stroke or cardiovascular disease. There's also a two-way association with diabetes. So diabetics are at an increased risk of developing gum disease, and oral infections can actually increase blood sugar levels, which can in turn create severe complications such as damage to the eyes, nerve, kidneys, and blood vessels. We also see that poor oral health is linked to malnutrition in our senior population. And did you know that seniors are actually less likely to visit the dentist despite having a higher level of need? And this is due to the fact of the high cost of dental care initially, and then increasing frailty and mobility issues as they age. So we also see that seniors have inequitable access to dental care. This can include those who have lower income, reside in long-term care facilities, homebound. They could have dementia or cognitive impairments, live in rural areas, and also depend on others for daily care. The Ontario Seniors Dental Care Program provides comprehensive dental care services to eligible low-income seniors. So currently, a single senior must have an annual net income of $25,000 or less, and a couple must have a combined net annual income of $41,500 or less to qualify. The main goal of this program is to reduce inequities by increasing access to dental care in our low-income seniors. The local implementation involves helping our seniors enroll in the program and navigate the system. We provide dental services directly through our on-place dental clinics, such as cleanings, fillings, extractions, and root canals. And we provide service indirectly through contract agreements with our local dentists and denturists. Several of our clients do have to travel to get to Sudbury to receive services, so they can apply for the Northern Health Travel Grant to help with the cost of travel. So many of our clients come to us with extensive and complex oral health issues, and this is often due to the fact that they've gone years or even decades without having any access to dental care. So this graph here, you can see that nearly 3/4 of our clients had no dental insurance in the 5 years prior to enrolling in our program. This slide here, we can talk about this use of dental care in the 5 years prior to enrolling in our program. So as you can see, 25% have not seen a dentist in 5 years or more. 8% had only gone for emergencies. 30% only went if they had a specific dental problem, whereas 35% did indicate they saw a dentist regularly for cleaning or checkups. In this slide, it's talking about the last cleaning a senior had prior to enrolling in our program. So 30% had a cleaning within 1 year of enrolling, and you can see quite a variation in the amount of years that have gone by, with 15% indicating they haven't had a cleaning in 10 years or more. We even had some seniors indicate that they've never had a cleaning. So we've provided services to more than 1,200 clients since the program was originally launched in 2019. And the ministry originally anticipated that the utilization rate would be about 1,500 seniors in our area. And this was based off census data and utilization rates of other public dental programs. So we have provided 727 clients with at least one cleaning appointment. 492 clients have had at least one appointment with a denturist. And 831 clients have had at least one appointment with a dentist for treatment. So we also have priorities we'd like to focus on for 2025 for our seniors program. So this includes continuing to recruit additional dental providers with a focus mainly on our districts, mainly Manitoulin Island and Sudbury East. Aside from Chapleau, all of our clients have to travel into Sudbury to receive services. We'd also want to increase opportunities for access in seniors in long-term care facilities or for those that are homebound. And finally, we would like to develop an impact evaluation plan, which will help us understand the impacts and benefits that our seniors program does have for the seniors in our communities. Thank you very much for letting us come today to explain our oral health programs with you. We are open for any questions you may have. Thank you. Merci.
Thank you, Stephanie and Jody, for the presentation. I'll open it up to any questions of board members.
Through you, Mr. Chair. Would you have a percentage of uptake from dentists with regards to the dental programs? I know that like some dentists will not, and some dentists do. I know of at least one dentist in Chapel that does. I can't speak for the other ones, right?
Yes.
Yeah, go ahead.
So basically, we don't have, the list is kind of always changing. So we don't actually have a list of dentists locally that are accepting either of the programs. So sometimes we see that they may accept so many Healthy Smiles Ontario program children, for example, and sometimes there might be a cap on how many they can take. So we don't have an actual live list of or rates of how many dentists are accepting the program. It does change so frequently.
Yeah, follow.
I do. For the Healthy Smiles program, what is the follow-up rate? Like when you refer a child to the Healthy Smiles program because they were found in dental screening, school dental screening, what do you have any stats on the follow-up rates for that?
Yeah, go ahead.
So one of the indicators we do have to report to the ministry is the percentage of children with urgent needs who are enrolled in Healthy Smiles for urgent care who do receive treatment within 4 months, or 16 weeks. So we have a pretty good response rate, at least 80% or more do get that follow-up within 4 months. And some of that could result in delays would be they might need general anesthesia and things like that take a little more time.
Last one.
Yeah, go ahead.
A lot of us are on well and septic, so no fluoridation is. I know that fluoridation is a very effective program, despite some people might speak out against it. Is there any plan or program in place to try and make up for that lack of access to fluoridated water for families? Yeah.
So I don't think we have a specific plan in place at this time, but promoting the use of the fluoridated toothpaste, seeing with dentists regularly who could provide fluoride treatments as well.
Okay. Oh, thank you. Thank you.
Mr. Chair, if I could maybe just add a little bit on to that answer. Now, I think what's really great about water fluoridation is that you have one water treatment plant, you do something there, and everybody who's served by it gets the benefit of that. So that, investment you make there really pays off because it's, helps so many people. The difficulty when you get onto like wells and private water systems is that it's a relatively expensive cost for really a very small number of people. So it generally isn't very cost effective, unfortunately. So as Stephanie talked about, some of the things that your dentist can do, give you fluoride treatments, make sure you're using fluoride toothpaste. You can buy fluoride drops and fluoride supplements yourself. So those are some of the options that are available. Unfortunately, it's just not as cost effective as being able to do it one time and having everybody benefit from it.
Thank you.
For you, Mr. Chair.
Yeah, go ahead.
Just wanted to add that with the Healthy Smiles Ontario program, there are certain criteria in terms of being clinically eligible for preventive services. And one of the criteria is whether or not they have access to fluoride.
Okay, excellent. Thank you.
I'll leave it at that.
Thank you, and through you, Chair. Really good presentations. And my full-time career job, I'm assistant manager of the Parkside Older Adult Center. I think we're going to be, I work with the older adult panel as well, and we're going to be organizing some seniors active living fairs. So I'm going to reach out to you to make a presentation. I think it's important. But further to your question about finding eligibility or different providers, I know through the work that I do, we go on the provincial website, and it brings you to a link from the program for seniors, and you click on it, and it brings you to Sun Life, which is the one that oversees like the reimbursement for the program. And it gives you by region, all the different doctors, dentists that are providing it. So I've had to do that for my seniors. So just for awareness for everyone else, if you've got people that want to know how to access it, I've had seniors come to me personally and be like, I don't know who is taking patients because it's a subsidized program. So not everyone's doing it, but it's a very comprehensive list. So it's really easy to access. Okay. Just want to add that. Thanks.
Have that information can be shared.
Yeah, like it's when you I don't even remember where I go. Honestly, it's on my computer at work. I just know that I go onto the website. I type in the Ontario dental plan. Like you type it in and it just brings you to that Sun Life website, and you click on it and you just type in Greater Sudbury and or Chapel or wherever, and it would just give you the list of who they are, their address, email address, fax numbers, all that stuff's there. So they're the ones inputting the information. I just Googled it. It brought me right there. So, yeah.
Thank you. Yes.
Are you referring to the federal? I believe like the list is accessible for the federal program, which is the Canadian Dental Care Plan, which isn't ours. So there you can find them through Sun Life, all the providers, but in terms of who's participating in the Ontario Student Dental Care Program, that's not available.
Okay.
Just wanted to make sure everyone is.
Oh, good to know.
Thank you for that clarity. Is there any other questions, directors? I just have two. One related to your slide where you had the bar graphs up and you said there's a percentage, I think it was 5% of other. What is other? Yes.
They may have just selected on the survey,
So it's not-
other, or there's no particular, they just wrote in an answer that didn't really fit with the other type.
Okay. My other question, recruiting for dental providers, is that a challenge or is that something that?
Yeah, it's a challenge to recruit for our seniors program. The reimbursement rate isn't as high as the Ontario fee guide, so that's one challenge. But like we mentioned, we want to try to increase access in the district offices specifically. We do have quite a handful of dentists locally on contract with us, but we're always looking to explore other opportunities to increase that access for everybody across the districts as well.
Okay. Thank you. Again, any other questions? Hearing and seeing none, thank you both for the excellent presentation.